Hi, this is Dr. Janet Allenby. Thank you for joining us. This is because looking good feels good. We were going to be having this live series for our viewers, our followers, and our patients who we so much enjoy. Welcome to my house, first of all, because of our social distancing. Allie and I welcome you to our house. You're seeing me a lot more casual than normal. So we are going to be having this on a regular basis. And what we're trying to do is get great information to our followers, our patients, because I think there's a lot of issues out there where people are getting kind of some maybe not great information, and I really want people to understand what's available to them and what people are able to have done aesthetically and what's realistic and what's not realistic. So bear with me because I am kind of new to this whole live thing, and so if I'm kind of making a mess here, sorry, but welcome and welcome to my house. Today I am going to be having Cristina Monaco join me, and since this is our first session, we are going to just kind of talk and start getting some dialogue going on what's new in our world. One of the big things that I think is important is, one, first of all, I want to tell everybody, I miss you guys. I miss you guys so much. I miss going to the office. And one of the big things that I've seen is that it's so therapeutic for me to be in the office. And one of the interesting things is I think it's as therapeutic for me as it is for my patients. Sometimes I think we don't do just cosmetic dermatology. We also do, we do a lot of psychological discussions, and one about relationships, one about how do we look good, all the things that we talk about, like girl talk all the time. So we are going to be I'm going to have Cristina join us, so she's going to be popping on as I talk here. So let me see if I can get Cristina on, and she might be popping on there. Let's see if she joins us. If not, she can join us in a few minutes. But anyway, I really miss you guys. And here we go right now. So I realized how much it helps me on a day-to-day basis getting to speak to everybody, being socially distant from everybody. Hi, Cristina. I'm just kind of talking right now.
Hi.
But being isolated is a little tough. I've always been kind of isolated on the weekends anyway, but it's because I have all week to talk to people that I really see how therapeutic it is for me to have the interaction and the discussions about all the things that we talk about, the girl talk, the relationship talk, the diet talk, the, what's going on, where are we traveling to discussions. So I do miss everybody, my staff, my patients, people that come and say hi. It's really important to me, and I want you guys to realize that, the social distancing has been hard on me. Okay, so anyway, one of the things also in the office that people know about me and my staff is that we have a very intimate relationship, and my job and my desire is always to help people. So I really want people to have the best outcome. So I'm very honest about what their needs are in their face, their body, and how do we make a game plan that's going to get them there the best. And, part of the game plan is what are we going to be doing, what procedures, what fillers we can use, but also, how do we do this with financial constraints too? And, who knows what's going to happen with this endpoint here, because we all know the market's been horrible and people are going to feel more of the pinch. And how are we going to do this and make ourselves still feel good about how we look like with all the things that are going on in our lives? So that's part of the game plan we do normally, but even more so now, I think it's going to be important to make sure that we keep things cost effective. So I do want to introduce Cristina. Cristina is our physician's assistant. She's joined us 3 months ago, and I will tell you guys, she comes from Long Island, and she's with us full time. She was trained by one of the top injectors in the country, and I think that we're very excited to have her. So Cristina, give us a little background about yourself, because I know a lot of people have been wanting to meet you and know more about you.
Great. So thank you so much. I'm very excited to be your first guest, and I love the segment. I am very excited to be part of the Allenby team, so thank you. I am a millennial, and maybe I'll share my age with you later, but I'm in my early 30s and I've been practicing for 7 years in cosmetic.
Anyway, because you look like you're 20 and can't be practicing that long.
I've been practicing for 7 years in cosmetic and medical dermatology, and for the last 5 years, I was with a fantastic practice. And yes, I was mentored and I worked alongside a fantastic injector like yourself. And my husband and I, in December, moved down here from Long Island, and it's been fantastic. We really love the quality of life that the Boca area has given us. And I'm just really excited to get to know your patients more than I have since I started in January, but also getting to know more of the community and really just sharing what I love to do, my passion, with everybody that comes to our office.
You know what, and I'm so glad that you, one, are also from another area. I will tell you, I think that you bring a fresh look and a fresh pair of eyes to the practice, because I think, sometimes things down here can get a little artificial, and people start thinking that's normal. And, being from an area that is a little more conservative probably than down here, I think you are a little more in tune to what's natural and what's natural beauty versus, when you come here. I think one of I think we had this discussion when you first started with me. You're like, everybody looks good. Everybody's fit. Their bodies look fantastic. Their faces look fantastic. And when you go across the United States, we all know you go certain places and they don't have the same standards of what we think looks good. And I think we all as a community strive to have that really wow aesthetic pop, because, it's more the norm here, but also we want to make sure that the norm stays in the natural and the aesthetically pleasing look at the end of the day.
Right. I definitely agree with that. I think that I've been to conferences and, who's an injector in LA, who's an injector in New York, who's an injector in Florida. Their techniques are a little different. But one of the things that I think we mutually can agree on is that natural doesn't mean that you have to, look, you just want to look like a better version of yourself. You want to look refreshed. And there's nothing more satisfying and, than to have a patient look in the mirror afterwards and say, wow, I still look like myself, but I look and feel beautiful, or I look and feel refreshed. So I think that's really important, especially when, you can go out and people will try to find somebody who, is maybe not, who's giving a little bit of a better deal, but nonetheless, you don't know what their outcome's going to be.
I think that's so true. It is the who, what, why are they injecting? I think those all have to fit together, and people sometimes put the dollar first. And honestly, we have priced out our prices, and we're the same prices as everybody. It's just more, I think we do a more full pan phase, we call it pan facial in our world, but we do the whole phase we want to do the whole thing. We don't just want to do one single thing.
Right.
And they don't really look any better at the end of the day. It's about the full look of somebody.
Right.
So I do think that, the whole outcome is the end point that we're looking for, instead of just one single thing. If somebody walks in and says, oh, I just want you to fill in this little line here, and I'm like, it's not going to help you at the end of the day. I want them to understand why. And I think it's our obligation to really educate. And that's kind of what this whole program is about, which this program is going to be, just for the people who are watching. We're going to be doing it weekly. We were planning on doing this prior to the social distancing event that we have. But I think that this is a perfect time. And again, the casual version of me, and welcome again to my house, and welcome to Christina's house. Thank you for letting us join you there. I think one of the great things that we did when we had you join is I really wanted to connect more to the millennial crowd. And, I connect very well to my baby boomer crowd. That's my generation. And, I think I get it because I'm living those cosmetic needs more. So you're more of a millennial, and, you're welcome to tell your age or not, but, tell us what you think, one, defines more the millennial and what their needs are versus maybe more people in my age group, because, it's an education to all of us.
So I am a millennial. I just turned 32, and millennials are into their mid to late 30s. And millennials, they start in their, mid 20s. And the millennial age group is honestly booming when it comes to cosmetic treatments. Now, everybody, even there was like a comment, why is everything always like fillers and Botox? Like, actually, we're here to educate more so on not just that, but the millennials are looking for a skincare routine, something very simple and easy. And so not everybody is jumping and running to the cosmetics, but millennials are very in tune with social media trends and influencers. We saw a huge boom, with makeup and face masks and things like that. And we also saw it with aesthetic treatments. So something as simple as skincare, a skincare routine in the morning and at nighttime is very simple and easy. And millennials are obsessed. There was a huge trend, and there still is, with naturally based skincare, or skincare when you go to a dermatologist and you want to know what you should be using in the morning, nighttime. The second thing too is, yes, people are getting more and more interested and starting earlier. We use the term prevention. Prevention is key, and millennials especially are tuning in and starting earlier in getting their cosmetic treatments. So something as like Botox or Dysport or Jeuveau. We saw a huge trend and a huge interest in hyaluronic acid based fillers, getting your lips injected, getting your cheeks injected. I think one of the things that you and I both agree on, though, is that, when people come in and they're just looking for one specific thing, it's up to us to educate them. Maybe it's not the best thing that they should be getting done, but we want to make sure that they look refreshed and their natural version of themselves. But nonetheless, millennials are really interested in getting treatments done. I always say too that it's not just like a 1 or 2 treatment option approach. We can't forget about a simple laser, or even something like a hydrofacial, that for somebody who's new in the aesthetic world that kind of is teetering and thinking of what they should be doing. Hydrofacials, which are combination therapy, is very simple and very cost effective.
So one of the things that you really touched on initially was skincare, which I wholeheartedly agree. And I think my baby boomer crowd, who they're a little bit more lax on this. Tell us what your skincare is. What do you do every day?
Okay, so my skincare routine is I wake up in the morning. Right now, I am using Obagi on my skin. I mean, I think that I like to change it up. It really depends. Coming from New York, my skin was more on the dry side. I really didn't have a ton of like issues with my skin. Now that I'm down here, definitely the humidity is kind of making my skin a little bit more, I would say I'm just having a little bit more combination skin. So for right now, I'm using the Obagi line. But ideally, like standard for me in terms of skincare is a great face wash. I love anything that is going to be vitamin C based, because I want to make sure that my skin is looking bright and it's giving off that nice natural glow. I really do like using things that have collagen base to it to kind of stimulate my own collagen. I mean, I am in my 30s, so I need to start thinking about collagen loss as time goes on. And these are things that I like to educate patients on too, because they just don't know. So if like staples in my skincare routine are, a great face wash, something that has vitamin C for brightening and also collagen stimulating
and I know for Obagi, you are using the sunscreen every day, right?
Of course. I say, look, even to me, though, sunscreen is something that is just a staple. I do it every single morning. I put it on before I put my makeup on. The Obagi comes with it, of course, but yeah, sunscreen rather is a must.
It's funny. I was just working with realself.com, which is kind of like a new beauty on computer. And I was doing an article with them for Cosmopolitan, and Real Self had done a study, and it was amazing on how many people do not use sunscreen on a daily basis, which is crazy. And women do more than men. But the interesting thing was men are more likely to reapply their sunscreen than women, which is just like, okay, so we kind of maybe start the boat, but we don't get going down the river with it. We have to start wearing our sunscreen more. Now in Florida in particular, this is huge. I'm sitting in front of a window here and I'm getting a lot of natural sunlight. And one of the biggest things I hear people say, even in the 25 years of derm practice, was, I never get in the sun. It's like, you are living in a sunny, our sunshine state is the name of our motto of our state, and people think they're not getting sun daily here, and they are, and I do even see that the people that are born and raised here, usually their skin quality is about 10 years older looking than they really are. And like your skin, amazing. When I go to Chicago, I see these women and their skin is like beautiful, and they're in their 60s, and I'm like, oh, I'm not in my 60s, and I think their skin looks better than mine. So I think the lack of sun there and us not wearing enough sunscreen down here might be a huge piece of that.
So true.
I know. So you know what? We have to wear sunscreen, and also wear it on your chest and your neck, because if the face looks good and the chest and neck don't look good, something's missing there. Okay. So back to, you were kind of touching a little bit on procedures people can do. And I think, and I'm going to use the word kind of Botox, because that's our Kleenex version of toxins, because people identify with that word more. So I agree. Botox is kind of our gateway drug into it. What would be your second most commonly asked for, and what do you like doing on patients?
So again, it's kind of hard. Like, what I love to do is I love to look at the patient's face and kind of assess like what they're coming in for. Everyone comes in for one thing. They think they want bigger lips or bigger that, like whatever. But for me, it's like my eye goes somewhere else typically. And I think you could agree with that. Like, that's how you practice also. They come in for one thing and I'm looking at something different. I do agree that, the whole face needs to be addressed and looked at during initial consultation. So one of the other areas that is pretty much a focus for me is the mid-face, the cheek area. And the reason why is because that is going to give the patient that youthfulness that they're looking for. They don't realize it, but this is where, when you're somebody who studies this or is trained down this or has a true passion for this, it's about realizing that maybe one area, like a lot of people will come in and they'll say, oh, this bothers me. Well, this bothers you because this is missing, right? So it's something that if I had to say like the second area or something other than Botox that I treat often, it's giving somebody more of a youthful appearance. And how do you do that? You do that in the cheek area. I think that doesn't matter what your age is. It doesn't matter if you are 28-year-old coming in for the first time thinking about getting something done, or a 58-year-old or a 68-year-old. We have to start with, how do we restore youth? How do we restore that youthful look that our brains are used to? And that's really what my second area would be. And how we do that is, a combination. A lot of times it's maybe a device, or maybe it's using a hyaluronic acid-based filler.
It is, I think you're touching on a huge subject matter, which we can do a whole live on this, talk about structures and how our brain sees attractiveness, and talk about, a lot of this is structural changes, and people don't realize it. Usually everybody sees aging in here, and it's because this is the end point of gravity. So that's why the neck and the lower face are the giveaways of age, is because that's where everything lands when they're more higher up. So that's actually for future, that's going to be one of our live Instagram, because I think, giving understanding to that makes a lot more sense. And, our job is to give natural beauty at the end of the day, and to make people attractive. And you and I have talked a lot about age appropriateness. I'm obviously older than you by, a couple decades. And I think one of the things is that I need to look good for my age group, where you are going to look good for your age group. And we don't necessarily want to maybe I would want to be in your age group, but I'm not going to realistically. So, how do we make the most attractive look for the age group that we're in, that's most appropriate, that, I think that's kind of the direction that we both kind of think positively.
Of course, yes. I think that one of the topics too that we were talking about and we've spoken about is, there's something for every age group, right? And doesn't matter, like sometimes patients will come in and just because, I'm not in the same age group as them, I think where we could benefit is like mutually, is having that rapport and having that relationship, coming up with something that works best, what's their concern, at any age group, and then, you know, working together as a team to come up with a treatment plan, but also educating. And I think you do a great job at that. You know, in our office, we have so many educational ways to show our patients. Some people are very visual and they have to kind of be able to see it in real life.
Like me.
Yeah, and they also are very happy to see great before and afters, and they can see that, you know what, they're going to not look overdone or overfilled. But somebody who, you know, comes in and maybe they're not in my age group, maybe they are, you know, more of my mom's age, or yeah, you know, how do we kind of create that rapport? It's really just about educating, and it doesn't matter what age group it is. It's, listen, these are your concerns, this is how we can address them. Maybe somebody, yeah, who's a little bit older is going to need a little bit more, so maybe we break it up in stages, or maybe we talk about doing devices in addition to the injections, and we just kind of come up with a game plan. You know, somebody who's in their 20s isn't going to need as much, most likely, as somebody who's in their 50s or 60s.
And it lasts longer on the young ones.
Yeah.
You know, it's kind of the unfortunate part of aging is that things just don't last as long. So, you know, I think you're totally right. And I, you know, I think one of the great things is that, Cristina, you've really, like, you can identify with all the age groups. It doesn't have to be just the millennials. So, you know, we don't want to peg you into just a millennial treater, because I think we'll see everybody, because, you know, this is what we love doing. So, and I know you do identify well with the older ones that have come in, and I'm one of the older ones, so you get it. And you know what? I saw what you did with your mother, and you really filled her fantastically. She was stunning the other day when she popped in. I was like, wow, she's hot. So, you know, your work is really reflected in some great results that I've seen.
Millennials, though, are out. Listen, millennials are not shy, and, you know, if I wasn't in this industry, I say it all the time, I would be on, like, my derms, like, speed dial. Like, it would be like, I would be like, can't wait to get back in and get things done. You know, it's just part of, you know, who I am and what makes me feel good, you know, and I think a lot of people resonate with that. And I can't even tell you that there's a lot of people that talk about it. There's a lot of people that say, yeah, I get Botox, yeah, I get my lips done, yeah, I get this done. It's not like a thing that people are afraid to talk about. It's actually
it's a little more generational also, because it is more of an issue with our older crowd, which, you know, they'll get over it and people will start talking about it because it's more of an open conversation out there.
Of course.
So I think that in the future, you know, people will be more comfortable with, no, I didn't get to this point by doing nothing. You know, this is not a mistake. This is very important information stuff here. So I think it's going to be, you know, something to see how things change. And definitely once we're out of the social distancing, you know, how things change with that too. Everything will change with what has gone on in our country. But you know what? I think that we all are on the same basis, that we want everything to be healthy and take care of ourselves. You know, being healthy and good to yourself, this is like the real bottom line. I think that's why we do so well, is because our goal is to help people do better for themselves, you know, and that's our number one goal, is just make you feel good about yourself.
Absolutely.
And, you know, I think that we don't want to go on too long, because I appreciate all the people who have joined us, and, you know, I don't want to wear out my welcome with you guys. So before we go on you, I definitely want to ask, and I am going to talk about real quick what we have going on in the office for promotions, because there are always something good going on. You know what, you know, regardless of even what's happening today with the distancing situation, how do you stay happy and healthy every day?
So I love to stick to a routine. I love to have consistency in my life. It starts with getting up early. It starts with going to the gym at least 4 or 5 times a week. I need to do that. And then also I really am not a big like TV person. I like to go to the beach after work and kind of just like go for a walk, or kind of just clear my mind. I think that's important to staying healthy. Of course, like drinking water and eating healthy, that's really important. And every so often reading a really good book. I think it's just about, like, you know, staying true to who you are and having that consistency in your life.
Beautiful. You know what? I think this little girl, she's one of my keeping me healthy.
Yeah, she's so cute. I missed her.
I miss her. You know what? Poor little thing. I miss the staff, but she's filling me up. But I will tell you, she doesn't feel good. I think I've been a little too motherly to her, and I've fed her too much stuff, and she isn't feeling so good today.
Oh.
Poor little baby. So thank you for joining us. And
Yes, it was so great.
Thanks. For promotions, okay, there's a couple things. Patients may not know that we have had for a long time a online store, and we are having a 10% off on the online store of ours. So if you go on the Allenby Dermatology website, you can click onto our online store. Now, there is actually a really good discount with Skin Medica. You have to go onto the portal through our website, and it's free shipping and 30% off Skin Medica. So those of you guys who are on TNS, which we know is not cheap, it is worth it, but it is definitely a great buy to get a 30% discount on that one. We do have gift cards for purchase. There's two of them. The first one is you get a $300 gift card if you spend $200. So you're getting $100 free from us. And this is to kind of help the sting of what's going on out there, and also help the sting for us. And we appreciate anybody supporting us at this time, because it's definitely a little bit of a crazy situation and potentially a financial hardship that can hit all of us. The other gift card that we have is a $500 gift card that is going to be for, you get a free cool tone, real quick, cool tone. One free cool tone is worth $750. So if you buy a gift card for $500, you get one free cool tone. These gift cards can be, if you guys want any information, direct message us and we can give you all the details on that one. That we're going to do it for both Allenby office and for the Body Squad office. So definitely utilize these. These are great ones. Cool tone, just so you guys know, I am like waiting to get back in the office to get back on my cool tone. For those of you who know, it has definitely helped shape my body and kept me in top shape. I would normally be skiing about this time of year, but can't. It has helped me get back on the slopes in a real strong way. It's a device that is non-invasive, it doesn't hurt, and it's a muscle stimulation device. It's electronic muscle stimulation device that will help strengthen tone, and that keyword tone means make it look better. And, you know, I think in my age group, the strength is a huge one, but toning is always like a pretty high up there too. You know, that's why we initially got the machines, were to tone us up and to make us look better, and because looking good feels good. So you guys, we are going to be doing some, potentially some more, we are going to look into doing virtual consults if this social distancing stays on longer. So we're trying to work all that out, and we'll kind of let you guys know if that's happening or not. So thank you so much for joining us. Cristina, thank you, and be safe. Everybody,
Thank you.
Be safe. Mwah, mwah, mwah. All right, bye guys. Thank you.
All right.